Broadcasting worldwide to every nation, this is the Gospel America Television Network. Broadcasting to every nation on Roku, Fire TV, Apple TV, and online at gospelamerica.net. It's time for Real Talk with the Jenkins, featuring Lady MJ, Pastor Marcella Jenkins, and Dr. G, Dr. Gary Jenkins. And now, let's join Real Talk with the Jenkins.
Hi, everybody. Welcome to Real Talk with the Jenkins. I'm Dr. G.
I'm Lady MJ. And we are the Jenkins.
Lady MJ, we've got a special guest that we're going to be sharing with you in a moment. He is a nationally renowned cardiologist, and he's based right here in San Angelo. And I'm excited to have him as our guest, none other than Dr. Milton Leon. And he has a practice called Cardiology Associates of West Texas. Now, how do I know that? I'm one of his patients. So we want to welcome Dr. Leon in a moment. We'll be back on Real Talk with the Jenkins.
Real Talk with the Jenkins. We'll be right back after these messages.
Hello, my name is William Narrow. This is my lovely wife, Ada Narrow. We are the Auto Pros Body Shop located at 528 West Avenue in San Angelo, Texas. Our phone number is 325-947-7767. Please call us if you're in need of a body shop, if you're in need of collision repair or hail damage repair. Many of our services are done in-house, from paintless dent repair, auto glass, vehicle diagnostics. Why that's important at a shop is you want to be sure to catch those electronic repairs issues before the car goes home, and you don't want the car to come back the next day because it's got an issue cooling or it's got an issue with a seat belt or an airbag. You always want to catch those before the car leaves. It's almost like, the analogy I like to use is having an x-ray done on your arm after they remove the cast to make sure the bone is completely healed before they send you home as a patient. That's why on all of our cars we do a pre and a post scan to make sure the repair is completed 100% completely to ensure a proper repair.
Dr. Chang's office.
Looking for a doctor who is right for you and your family? Then you've got the right place when you come to Dr. Peter Chang.
So what I do is general family practice. I take care of the population at large, pretty much any age group. We do mostly adults and elderly a lot. Basic medical problems, hypertension, diabetes, heart problems, and some complicated problems such as kidney problems and some skin problems. But pretty much we do a general spectrum of family practice. I just don't deliver babies, that's all. My goal has always been, and my motto has always been, that when the patient leaves my office, they're just as well educated about the disease process as I am, so that they go out here knowing what to do to handle their problems.
That's the offices of Dr. Peter Chang, located at 303 West Harris Street, San Angelo.
My name is Travis with Graves Transmissions. Here at Graves Transmissions, we have a reputation for customer service, and we've been serving the San Angelo area for over 45 years. Our focus is you, the customer. So whether you need a diagnostic check or complete transmission service repair, we're here for you. Graves Transmissions, where service meets quality, and that's our #1 priority. We are here when you need us.
Graves Transmissions, 1202 Pulliam Street, San Angelo. Are you ready to produce your own TV show? If it's a television commercial you need, then the Gospel America Television Network Studios is the place where your visual vision comes alive. You can meet with your production team in our warm and comfortable suite. And then you can start the production process using our green screen digital technology. Your broadcast will air on Roku, Fire TV, and online. We produce many types of TV commercials, like the Auto Pros Body Shop. Maybe you're looking to produce a medical commercial like the office of Dr. Peter Chang. Pastors, you can produce your broadcast airing on Roku or Fire TV. Call 203-410-6053 for studio booking. The Gospel America TV network. And now back to Real Talk with MJ and Dr. G.
Hi, everybody. As I said before, I'm excited because our special guest is none other than, who is this guy right here?
Dr. Milton Leon.
Dr. Milton Leon. I want to welcome you to Real Talk with the Jenkins.
Thank you very much,
Yes.
Mr.
Dr.
Jenkins.
Leon, you are awesome. We've been trying to get you for 2 years.
Yes, yes, yes.
That's how busy he is.
Yes.
Very busy man. So we're honored that he took the time to be with us right here on Real Talk with the Jenkins. Now, we got some really, really important information we want to share with you because a lot of people don't know about something called PAD, Peripheral Arterial Disease.
You did well on that. Wow.
The brain is working every once in a
Wow.
while. Talk to us, Dr. Leon. You as a cardiologist, you deal with this all the time, but a lot of people don't know what that is. And they don't recognize the symptoms because I really think we just haven't been educated.
That is correct. First of all, I want to thank you for the opportunity to be part of the American channel, the Gospel America channel. And it's an honor for me to be here and be in this interview with both of you. Peripheral arterial disease is a disease that causes narrowings or blockages of the arteries that provide blood flow to the organs away from the heart, and particularly blockages to the arteries that provide blood flow to the legs. The main cause of this disease are the following risk factors: high blood pressure, diabetes, high cholesterol, and smoking. Also, lack of exercise may lead to development of peripheral arterial disease.
So smoking also can lead to this.
That is correct. Smoking has been implicated in the development of coronary artery disease, but also causes narrowings in all the arteries of the body. And if patients develop blockages to the arteries to provide blood flow to the brain, they may have a stroke. But they can also develop blockage to the arteries, provide blood flow to the kidneys, and increase the risk of hypertension. And if they develop plaques in the arteries that go to the legs, this is called peripheral arterial disease that cause significant symptoms that may lead to amputation.
Now, correct me if 'cause I remember having this pain in my left leg, and I thought it was just, I don't know, I just thought it was just maybe
Arthritis.
yeah, I thought it was arthritis. I thought it was just something that was age related, and that wasn't the case at all. And I have to give props to you, Dr. Leon, because Dr. Chang suggested that I come to you. If y'all know Dr. Peter Chang, great medical doctor, but he doesn't specialize in cardiology. You do, so he recommended you to me, and you did an examination and found out I had PAD or PAD.
That is correct. Several patients with PAD may not have symptoms, or they may have symptoms that they don't attribute to this disease. They believe that their symptoms are due to natural aging process or due to some other condition that can cause pain to the legs, such as arthritis or lower back and pain and spine issues. The most common symptoms that the patients need to be aware that are due to peripheral arterial disease are the following: pain of the legs with exercise that limits their ability to walk further and walk as much as they could a few years or a few months ago. Some patients also experience pain at night and restless legs, and they cannot explain where this is coming from. This could be a sign of peripheral arterial disease. This is called nocturnal restless leg pain syndrome. Other patients experience discoloration of their legs and their feet, changes in the color, more red or sometimes more bluish color, and this could be a sign of poor circulation, could be a sign of PAD. Other symptoms are some non-specific leg heaviness, fatigue, and sometimes mild swelling of the lower extremities. Also, decreased hair growth at the toes is a sign of poor circulation due to the presence of peripheral arterial disease. So all these symptoms indicate that the patient may have peripheral arterial disease, which is a very important condition to diagnose early and treat it, because if it is left untreated, can lead to amputation.
So
Wow.
I could have ignored this, not being educated to what was going on, and could have lost a leg. That's pretty serious.
That is correct. And it is very unfortunate that more than 50% of the patients that have undergone amputations in the United States for the last decade, despite the advancements in technology and public awareness, never had an evaluation for peripheral arterial disease. So what I'm trying to explain, Gary, is that more than 50% of the amputations of the lower extremities could have been prevented if the physician had thought to do an evaluation to check for peripheral arterial disease and treat these patients accordingly before they come to the last stage of gangrene of their feet or the legs that required amputation.
Wow. So it's really important for us to understand and watch our body, because our body talks to us and tells us that there's something wrong. But if you're not educated, then you're not looking for the signs.
That is true, Marcella. The public awareness about the symptoms of this condition is very important in order to start immediate detection and prevention. Peripheral arterial disease can be detected very easily with a non-invasive test that we perform in our office, which is called ankle bronchial index test. What that test is very simple. We check the blood pressure in both arms and the blood pressure at both feet at the ankle level. And the blood pressure at the ankles should be a little higher than the blood pressure in the arms. If it is lower, significantly lower, that means this patient may have peripheral arterial disease. That is the first screening test. If the screening test is abnormal, then we have more advanced testing to diagnose this disease, which is again a very simple non-invasive test, which is an ultrasound of the legs to check the arterial blood flow. That gives us a little more information about the extent of the disease and the location of the plaques in the legs. That will help me, the vascular disease specialist, to plan the treatment of this particular patient. What is also important is for the patients to be aware which are the conditions that raise the risk of peripheral arterial disease.
Yeah, let's talk about that, because you had mentioned earlier that African Americans suffer from this in a much greater capacity than other races and than other nationalities. Why is that?
I believe that this is attributed to the higher incidence of diabetes and hypertension among the African Americans compared to the other population, and also Hispanic population have higher incidence of diabetes and hypertension, and that also puts them at much higher risk for PAD than the non-Hispanic population.
So you were saying the high risk of being a diabetic. Okay, so why do we find in Hispanics in African Americans that they're more with diabetic issues and hypertension.
Yeah, most likely has to do with their diet and lack of physical exercise, and these are two major risk factors that increase the risk of diabetes and obesity, which is also another risk factor to develop heart and vascular disease.
Wow.
We're going to learn more about peripheral arterial disease in a moment. We're going to go to a commercial break. You're watching Real Talk with the Jenkins. I'm Dr. G.
I'm Lady MJ.
And
we are the Jenkins.
Real Talk with the Jenkins. We'll be right back after these messages.
My name is Travis with Grace Transmissions. Here at Grace Transmissions, we have a reputation for customer service, and we've been serving the San Angelo area for over 45 years. Our focus is you, the customer. So whether you need a diagnostic check or complete transmission service repair, we're here for you. Grace Transmissions, where service meets quality, and that's our #1 priority. We are here when you need us.
Gray's Transmissions, 1202 Podium Street, San Angelo.
Dr. Chang's office.
Looking for a doctor who is right for you and your family? Then you've got the right place when you come to Dr. Peter Chang.
So what I do is general family practice. I take care of the population at large, pretty much any age group. We do mostly adults and elderly a lot. Basic medical problems, hypertension, diabetes, heart problems, and some complicated problems such as kidney problems and some skin problems. But pretty much we do a general spectrum of family practice. I just don't deliver babies, that's all. My goal has always been, and my motto has always been, that when the patient leaves my office, they're just as well educated about the disease process as I am, so that they go out here knowing what to do to handle their problems.
That's the offices of Dr. Peter Chang, located at 303 West Harris Street, San Angelo. Are you ready to produce your own TV show? If it's a television commercial you need, then the Gospel America Television Network Studios is the place where your visual vision comes alive. You can meet with your production team in our warm and comfortable suite. And then you can start the production process using our green screen digital technology. Your broadcast will air on Roku, Fire TV, and online. We produce many types of TV commercials, like the Auto Pros Body Shop. Maybe you're looking to produce a medical commercial like the office of Dr. Peter Chang. Pastors, you can produce your broadcast airing on Roku or Fire TV. Call 203-410-6053 for studio booking. The Gospel America TV Network. And now back to Real Talk with MJ and Dr. G.
I'm Dr. Leon. I'm an independent interventional cardiologist practicing in San Angelo over the last 18 years. This room is our endovascular suite. This is the first outpatient cath lab in Concho Valley. We perform invasive procedures to improve the blood flow to the patient's legs, arteries, and veins. We have all the equipment we need to perform these procedures very safely in these outpatient settings. We can perform a atherectomy, which means remove the build-up plaque from the arteries of the legs, do balloon angioplasty, implant stents if needed, and we have all the technologies that the major medical centers have required to perform these procedures.
We are here with Dr. Milton Leon talking about PAD.
And PAD stands for Peripheral Arterial Disease, and it's a disease that a lot of African Americans contract, and we don't even know that we do it. Mm-hmm. And I personally believe that we're not educated about this disease, and it's directly related to your heart. And if left untreated, based on what Dr. Leon has told us, you could lose a leg, or or suffer
you
some
get-
other serious ailment.
Yes.
Okay. Well, we're going to go back to Dr. Leon, because I'm telling you, he's phenomenal. And Dr. Leon, we're just happy that you're with us and taking this time to be with us. But as I said before, there are so many of us in America, African Americans, that just don't have access to the type of medical treatment that is needed to properly diagnose and give a prognosis of PAD. Why?
Yeah, it is true that the incidence of peripheral arterial disease, which is the condition that causes blockages to the arteries that provide blood flow to the legs, and if left untreated can lead to amputation, as you mentioned earlier, is much higher. The incidence of PAD is much higher in African American population than the other populations. Also, the Hispanic population has higher risk of PAD. To my opinion, and what the literature and epidemiologic studies have shown, is due to the higher incidence of diabetes and high blood pressure in the African American population. And as we discussed earlier, this has to do with lack of exercise and diet, which increase the risk of diabetes and also increase the risk of developing high cholesterol. So public awareness of these issues is very important. So everybody, the African Americans, the Hispanics, and all people need to have frequent checks with their primary care physician in order to diagnose these diseases early and prevent development of worsening problems such as peripheral arterial disease and heart disease. Of course, the cost of the issue in healthcare is very important, but patients need to mention these symptoms to their primary care physician and go for routine checking. And the routine checking, could be rather of low cost, or it should be of low cost, in order for every patient to be educated and be given the appropriate instructions how to change their lifestyle and prevent the development of diabetes, treat their hypertension, prevent the development of high cholesterol. And by treating these diseases is the best way to prevent the worsening problems such as peripheral arterial disease and heart disease.
So I want to make this clear to our viewers. Listen, folks, if you've got pain in your leg, going down the side of your leg like I did, and you haven't gone to the doctor, please go to your family physician. Get a checkup, because if you don't, you could lose more than what you expect. I can't imagine having to go through an amputation all because of ignorance, not knowing that this is something that could have been prevented had we just simply realized we got pain, there's something wrong, because we got to listen to our bodies. Something's wrong, and I need to get a checkup. Now I want to ask you another question, Dr. Leon. Is this something that medical insurance should normally cover for anyone that needs to get an exam?
That is correct. All insurances cover for the very simple test that I mentioned earlier, the ankle brachial index, and then an arterial ultrasound to check the blood flow to the legs in the patient who has significant risk factors to develop PAD or any symptoms to suggest that may be a possibility of PAD. And these are non-invasive tests, which are rather inexpensive. In our office, and I'm an independent physician, we offer special low rates for patients who are paying out of pocket for this test, because we believe that everybody should have access to the basic health care for prevention and treatment of heart and vascular disease. So my goal as an independent physician is to be able to diagnose this problem and with as low cost as possible for patients who are paying out of pocket for their testing.
So it can be done directly in your office, this procedure to test for the PAD.
That is correct, and it's a very simple test we can offer with a very low cost in order to start the process of diagnosis of PAD, which can lead to a very serious complication in the future.
So that treatment, and once you're diagnosed with PAD, can you treat it in your office?
That is correct. The treatment of PAD starts with medical therapy. Medical therapy consists of medications to decrease the symptoms. Then we can do a procedure in our office to improve the blood flow in the arteries and the legs of the patients with peripheral arterial disease.
Well, we're out of time. This has just been phenomenal. We're going to have you come back because there's so much more that we need to know about cardiovascular disease. But I want to certainly thank you so much for being with us on Real Talk with the Jenkins.
Thank you very much, Gary.
And Lady MJ, I tell you, you know, this is just a blessing to be able to share with our viewers, because most people do not understand the fact that according to medical documentation, cardiovascular disease is the #1 killer of Americans today. And it kills more people than the flu or than heart attacks, or well, not heart attack, cancer, or some other disease. And so it's important for us to take care of ourselves, become aware of our lifestyles and how our lifestyles are impacting our health.
Yep. I've been to Dr. Leon's office and had the testing done because my legs were hurting at night and, you know, hurting during the day. And so it is very easy to get it done and not painful. That's the good news. That's the good news.
And he says that most insurances will cover the cost of a non-invasive procedure to just examine to see if you have peripheral arterial disease. I said it worked.
Yes.
And, so listen, folks, please, ma'am, sir, whoever, take care of yourself. Will you do that? Because your health is more important than anything else. You're watching Real Talk with the Jenkins. We want to thank you for tuning in. We want to thank all of our sponsors, and we pray that you take good care of yourself, okay?
Yeah.
So, till next time, I'm Dr. G.
I'm Lady MJ, and we are the Jenkins.
Broadcasting worldwide to every nation, this is the Gospel America Television Network. Broadcasting to every nation on Roku, Fire TV, Apple TV, and online at gospelamerica.net.